Hi there, my name is Jessica Bailey. Today we're going to talk about moisture-related challenges in embalming. So we're going to start with generalized edema. So what is edema? It's a collection of fluid into the tissue spaces or the serous cavity spaces or even both. Why is this important? It's important because the embalmers need to know what type of edema and how to treat it properly. So some challenges we're going to be faced with is the tissues are going to be swollen. Usually the hands and the face are the most common areas. With bedridden patients, edema is normally present in the dependent areas. Any surgical or embalming incisions are potential leakage site, and this also carries over to the fluids, can also dampen the clothing of the decedent. The preservation fluid will also not be dispersed evenly throughout the body, and you typically have a quicker decomp cycle when edema is present. So a couple of solutions that we can go through. Some techniques are sectional arterial injections, elevation, use the gravity to work with you, protective garments, absorbent powder, start with a slow rate of flow, and make sure you have a good distribution. So some chemicals, use a high index solution, but be careful not to go too high because you don't want to over dehydrate. Some strategies, maybe consider a waterless solution with the edema. There's so much fluid already present that a waterless solution the chemicals can get in there really well. And with a regular traditional solution, it's a losing battle. Be sure to remove as much edema as possible from the tissues, and please make sure that the tissues are drying and that preservation is achieved. So next we're going to talk about dehydration. So what is dehydration? It's the loss of moisture from body tissues that may occur ante-mortem or post-mortem. So why is it significant? It's significant because embalmers are going to face this day in, day out. Whether it occurs ante-mortem or post-mortem, we need to know how to address these situations when we're faced with dehydration. So I listed two types of different challenges. We have a local dehydration challenge, and we have an arterial embalming challenges with dehydration. So local, you have skin slip, abrasions, razor burn, or the epidermis is removed for transplant. With arterial embalming challenges, you have thickened blood, darkened skin, the face areas and hands can be flaky or peely. The skin can feel firm. You have wrinkled lips in the facial areas and the fingertips, and desiccated lips, eyelids, or fingertips. So a couple of things I would use, starting with techniques. Use a slow injection. Make sure you inject large volumes of fluid to replenish that lost moisture. Use intermittent or alternate, drainage to help the tissue retain the moisture. Use a moderate arterial solution for our chemicals, and maybe the use of a humectant co-injection fluid. Do not use an excessive amount of humectants because it will typically cause the opposite effect. So strategies is to avoid excessive massages of the hands and neck, and do not expose decedents into direct air currents if you can help it. So next we're going to talk about tissue distension. So what is tissue distension? It's the swelling or enlargement of body areas, particularly in the hands, face, and neck. So why is this significant? The embalmer needs to know and understand how to properly treat it without causing any further mutilation to the body. So some challenges that we're going to face is excessive fluid in the hands, facial, and the neck areas, as I said previously. Excessive moisture causes a lot of bacterial growth. We don't Our goal is preservation, not bacterial growth. Next challenge, we have an improper distribution of arterial solution to different areas of the body. And as well as generalized edema, we also have a more rapid decomp rate. So a couple of solutions here. We're going to start with techniques. Channeling. Channeling can help make pathways for the arterial solution to distribute properly and evenly. Elevation can also help, once again, using gravity. And applying pressure wraps to force those fluid areas to distribute and go to other areas of the body. So some chemicals. We're going to go with humectant, but once again, be careful and mindful of using too many humectants because it will reverse it. Also using a high index solution, but be mindful because you don't want to dehydrate those tissues. Some strategies is to use a low pressure when injecting embalming solution. Maybe try restricted drainage. And also maybe minimal massages to aid the fluid to distribute, going back to the techniques. So in conclusion, we as embalmers need to understand these moisture-related challenges. If we know and study them, it will make us better embalmers so that we're prepared and knowledgeable of the situation that we're given. I actually did learn a lot from building this presentation because there is no one-size-fits-all. Every decedent that crosses the table, it's going to be completely different. At the same time, we also must be mindful, respectful, and ready for any type of situation that can happen. Thank you.